Soji Adeniyi. Soji Adeniyi is a social development expert, and he has over 20 years of hands-on humanitarian experience with the United Nations. He was a preparedness expert and supported the Nigeria National Platform for Disaster Risk Reduction, DRR. He is the lead facilitator and convener for the African Network for Disaster Risk Reduction and Sustainable Development. In the health sector, he supported several key initiatives of the government of Nigeria, such as the National Pandemic Preparedness and Response Plan and the National Health Emergency Management Framework. And he was a key member of the National Ebola Response Team in Nigeria. Olushola Adeniyi, I want to welcome you to the platform. We'll have just 10 minutes. Thank you. You're welcome.
Good day, everyone. I hope you can hear me.
Yes.
Can you hear me now?
Yes, loud and clear.
Oh, okay, excellent. I'm excited to be here, and I want to congratulate the Nigerian Network of Nigerian Health Historian Network. I think you guys are doing a great job helping us to navigate this very, very interesting aspect of our history that we must not allow to go away. I worked with the United Nations, especially working around emergency management and humanitarian response for over a 21-year period before taking early retirement a couple of years back. And in this period, I worked around multiple environments, including working in Asia, in Africa, and finally in the headquarters in New York. But my experience at home would be the focus of this short engagement, which is to say that we came a long way ourselves. And I was so glad when Prof was analyzing the history of the Nigeria School of Hygiene and the introduction of the sanitary inspectors and how we actually passed through the various stages to become the kind of nation that we eventually became. Because if you recall very well, before COVID, the world expected that it would be a major problem in Africa. In fact, I recall that some development workers actually predicted that there would be bodies on the streets, and they were wondering how we were going to cope, because they anticipated that this is just going to expose the vulnerability of Nigerians and Africans in general. And to the glory of God and to the effort of the men and women that worked hard around getting us ready, I think we succeeded in 2020. Africa and Nigeria in particular successfully navigated the challenges of COVID. Maybe we banked more on the experience that we had with previous pandemics like Ebola that came in years before the advent of COVID-19 in 2020. Personally, I was involved in multiple humanitarian responses in Nigeria. I was part of the team that actually started the humanitarian response in the Northeast Following the Boko Haram insurgency that led to the displacement of millions of people in the northeastern part of Nigeria. Nigeria has a very large population of close to 200 million people. And so you can imagine when a region consisting of just about 3 states having close to 10 million people were affected by the Boko Haram insurgency, which is purely, a religious insurgency, but that brings in a lot of uncertainty and insecurity, leading to multiple humanitarian crises. And of course, a lot of the people that were affected had to move out of their comfort zones because they were attacked, they were under a lot of pressure. So they moved into nearby urban cities, and then they took over almost all the space in that area. So medical systems, traditional medical practices were all overwhelmed because of the rush of the people that were running away from the insurgency. And the first challenge we had was that, in the traditional African society, everyone is your brother when they probably share the same religion with you, or they share the same ethnicity with you. Nigeria has, a very interesting cultural and ethnic diversity of over 250, tribes and groups and ethnic groups. So these people moved into those areas, those states, and they practically took over, exceeded the capacity of the water system in the states, exceeded the capacity of the medical systems. So humanitarian intervention became necessary. And just like Madam George said, a lot of religion-based organizations, a lot of civil society organizations came in to support the effort of the government. So the government was there, but the systems and the services were grossly overwhelmed. Then you talk about the ones that happened in the northwestern part of the country. Again, another very huge terrain, starting from the extreme west, northwest, where you have the Sokoto Caliphate and the rest of them, all the way to Jigawa in the closer to the north central area. And then you have several people again that were affected because of banditry and cattle rustling and all of this. So you see a lot of, events that happen, and you just have to respond as humanitarian workers. And this goes on over and over. That makes the work substantively difficult, because you as humanitarian workers, despite the fact that you bring succor to families, you are actually also at risk, because you are sworn an oath of neutrality. So even when you see people that are attacking other people and they are wounded, they are still, they still needed to be attended to. If you are distributing food items or health emergency supplies, you cannot afford not to give to them, because neutrality is something that you have to respect by international standards. But one thing that stood out for me in all of this, because it wasn't only in the north, even in the south, there were crises that were informed by, indirect causes. I mean, sometimes in health, we think that it has to be a pandemic for responses to be triggered. But sometimes flood and erosion causes a lot of damages to families and to communities. For instance, the communities down the Niger River and the Benue River, when waters are released from the Lagdo Dam in Cameroon, or the Futajalon, islands in Niger and in Mali, it all comes down to, a place we call a confluence in Lokoja, and then it triggers all the way down to the Niger Delta. And you could imagine the gross effect of that. Most homes are submerged for months, and then again, government has to come in, international agencies have to come in. Agencies like UNICEF that I worked for during that period had to come in consistently, managing the large, outlay of people that are affected by those insurgencies. So you have, institutions like Medicines Without Borders all coming in, Save the Children, all of us trying to work together as humanitarian workers, rescuing people who are running away from the flood waters. But guess what happens? The flood would mean that the water would have passed through all kinds of grounds before coming, to pass through communities. And then, of course, the water are laden by all kinds of germs and bacteria and the rest of them. And then, of course, cholera automatically follows in those situations. So you may have rescued people from the flood effects. You may have rescued them from harmed forces and non-state actors and all of that. But you may lose them very easily to cholera. You may lose them to meningitis, because of the fact that they are going to be all packed in very non-conducive accommodation and areas where they're going to be. So these are challenges that health workers, that humanitarian workers face on a daily basis in Africa and in Nigeria in particular because of our large population. But the good thing that we see from time to time is that because all of us are now working with the sphere standards, so there are specific humanitarian response standards that have been defined for all humanitarian workers to work with. We are forced to enforce that and ensure that not only that the government is trying to monitor performance. So for quite some time, I was responsible for humanitarian performance management. And all this period, we had to make sure that each component, each area of sector that needs to deliver results, such as the Nigerian Red Cross, which is an auxiliary to the government, such as the civil society organizations that are, likely doing advocacy to make sure that the government does not leave anyone behind. And then, of course, the international organizations and the local non-governmental organizations like Mrs. George, they all have to play specific roles and responsibilities to make sure that we get to where we are today. And personally, and rounding up, I think that one of the reasons and the success factors for the success with the COVID-19 situation was because we already developed the National Pandemic Preparedness Plan during the crisis with Ebola. And thank God that Prof was in the house to explain that she was part of the setting up of the first National Reference Laboratory, for ease of identification and isolation. So we had all those groups trained in preparedness for the national pandemic. And we worked closely with the National Emergency Management Agency, closely with the Nigerian Ministry, the Federal Ministry of Health and State Ministry of Health for all vulnerable states, especially the high-risk states and communities at risk, those who are, vulnerable and have been mapped based on the National Pandemic Preparedness Plan. So all these were areas that actually showed that, Africa has come of age and has developed sufficient, capacity to manage and monitor and actually come up with successful plans that actually could be used anywhere, around the globe to show that we indeed have, come of age. So I think it's in all of this, yes, I do agree, the National Action Plan for Health brings all this together under one umbrella with the National Center for Disease Control being responsible, of course, for the pandemic and the challenges that comes from that particular space. But I want to say that it was indeed a very interesting experience for me for over 10 years in the country and, over 20 years around the globe. I was in Indonesia when they had the tsunami, and I was in Liberia and Sierra Leone when they had the civil war, and I was in the Congo when they had the Ebola crisis. So I of course, in Nigeria during our own Ebola crisis as well. So these gave me, a good insight into what our health professionals actually delivered during this period. Of course, we had good support from our friends across the globe, but they weren't bringing any special effect to the table. It was simply to engage with, existing professionals around what we do. And I worked with the Nigerian Institute for Medical Research in Yaba that Prof mentioned, on looking at the practicability of some of the tools that we developed for collecting sufficient on-site GPS-enabled data for rapid EMS transfer for WHO to be able to pick up data quickly enough to be able to, advise changing trends, even when isolation and has been done, and patients have been identified to have specific type of pathogens that needs to be monitored and and tracked. So this was the things that happened during my years in humanitarian performance management in Africa, and I think it was a good experience. And I see that they're still, following a lot of those paths. And I do not doubt that, with the effort that you guys are making now, there will definitely be a lot of reason to celebrate. Thank you.
Thank you so much. Thank you for coming around, and thank you for that wonderful talk and presentation. Really appreciate your effort globally. Thank you. Really appreciate you. And
my pleasure.
You continue to go higher, higher, and higher.
Thank you. Thank you very much.
So on this note,